Okay, this lecture is going to be on bone density. So the purpose of bone density, so we measure the minerals within the bones. It detects bone loss, establishes the diagnosis of osteoporosis or pinea, assesses an individual's risk for fracture, assesses the response to osteoporosis therapy, and perform vertebral fracture assessment. So bone densitometry is a general term used to describe the art and science of measuring bone mineral content and density of specific skeletal sites or of the whole body. So we use it to assess bone strength, diagnose disease of bone minerals, and monitor therapy, predict the fracture risks. And uses techniques of ionizing radiation or ultrasound. Most common is dual energy X-ray absorption, which is also known as DXA, D-E-X-A, or DXA, but we call it DXA. So the advantages of using the dual energy is low radiation dose, readily and available, simple to use, really short scan times, we get high resolution images, it's precise, and it has stable calibration. So some history here, 1920s, first demonstration demonstrated osteoporosis, the 30s, first article on bone mass quantification, the 60s, bone loss and astronauts sparked radiogrammetry. Oh. 1970, quantitative computed tomography, and the 70s and early 80s, first dedicated bone densitometry unit. In 1987, first commercial DXA scanner. In late 90s, development of a smaller, more portable units for peripheral scans. So, bone biology and remodeling. So remodeling is the process of old bone absorption and new bone formation. So stable bone mass requires equal reabsorption and formation. Peak bone mass is 20 to 30 years of age. And it's a stable period during the middle age, and decrease in bone mass begins at 50 in women and 65 in men. So osteoclasts remove bone, causing bone reabsorption, where osteoblasts build or replace bone tissue. After 35 years of age, more bone is removed than replaced. Estimated 44 million in the United States are affected by osteoporosis. The medical, economic, and social costs are $19 billion a year back in 2005. So imagine what it is now. Early detection and treatment is critical. Where osteoporosis is a disease characterized by low bone mass and structural deterioration of bone tissue. Estimated 10 million people in the U.S. have osteoporosis, and 80% of those are women. So there's two types, 1 and 2, and there's secondary, so primary and secondary. Also, so clinical indications, women with estrogen deficiency, individuals with vertebral abnormalities, individuals receiving glucocorticoid therapy, individuals with hyperthyroidisms, and individuals undergoing osteoporosis drug therapy. So, risk factors are being female, increased age, estrogen deficiency, Caucasian, low body weight, family history of osteoporosis, and history of prior fracture as adult, and smoking tobacco. So in my genetic pool, all the way up the lines, both sides, osteoporosis, and I've been osteopenia since my 20s, which is crazy. So additional risk factors are hormonal conditions and diseases, neuromuscular disorders, long-term steroid use, poor visual acuity, which is interesting, long-term disabilities where you're not mobile or do weight-bearing exercises, low dietary calcium intakes, and vitamin D deficiency. So bone health recommendations. So the National Osteoporosis Foundation Bone Health and Prevention recommends that you take recommended amounts of calcium and vitamin D. The new trend is to cut back on calcium and just take vitamin D, because they're finding that calcium does build up in the arteries and can cause kidney stones. That's new stuff. It's just cutting edge. So, Engage in regular weight bearing and resistant exercising. Avoid smoking and excessive alcohol. Talk to a healthcare provider about bone health and have bone density tests and take medications where appropriate. So the physical principles. DXA is a subtraction technique. So the bone mineral density measured without soft tissue. So 2 different X-ray photon energies pass through the patient. Detectors separate and measure the low and high energy photons received from the patient. So measurements and acquired BMD are calculated by software. Machines from different manufacturers operate differently and yield different values, so it's important that the patient goes back to the same machine each time to have a consistent reading. So BMD measurements from different machines are not comparable without standardization, so really important that it's the same machine each time. Original scanners use pencil beam and a single detector. Newer technology uses an array or fan beam with multiple detectors, and it reduces the scan time. So mathematics of bone densitometry, there are 3 key things. So there's the mean, the standard deviation, and the percent coefficient of variation, so the percent CV. The mean is the average, so it's the sum of the data values divided by the number of values. The standard deviation is a measure of the variability, measures the spread of data values around the mean. Small spread is smaller standard deviation, and a smaller deviation is better in bone densitometry. So the mathematics of bone densitometry, so percent of CV allows the comparison of variability between different data sets, whether or not they have the same mean. So you take the percent CV equals the standard deviation divided by the mean times 100. So you don't need to know this, just so you know the difference between and how to calculate if you have to. So smaller percent CV is less variability, and the smaller percent CV is better in bone densitometry. So accuracy is the ability of the system to measure the true value of an object, so determined by the calibration of the scanner, which is set and maintained by the manufacturer. So precision is the ability of the system to reproduce the same but not necessarily accurate results in repeat measurements of the same object. Each DXA laboratory should determine its precision error and calculate the least significant change. So the technologists, core competencies. So there's radiation protection, patient care, clinical history taking, basic computer operations, scanner quality control, patient positioning, scan acquisition and analysis, record keeping, and documentation. So other techniques, so there's the central axial skeletal measurements, there's total body and body composition, pediatric assessment, and peripheral skeletal measurements. So how do we look at these? We go by T-score classification. So the classification is T-score. Normal is no lower than -1, where osteopenia is lower than -1 but higher than -2. Osteoporosis is -2 or lower. Severe osteoporosis is -2 or lower combined with 1 or more fractures present. So I'm going to show you what that looks like, so don't freak out. Types for drugs, there's different estrogen replacement therapies, there's different hormones that we can give. I don't really want you to know what kinds they are. So contraindications is too low of a body mass, so if the patient has just skin and bones, it's not going to read it properly. Anatomic malformation, so severe scoliosis or kyphosis makes it almost impossible to do these. Metallic prosthesis of the affected or anatomical side. So we usually scan the lumbar and we'll scan a hip. So if the patient has bilateral hip prosthetics and a fusion in the spine, we're pretty much stuck. It's a contraindication for the exam. Pregnancy, so that would be bad. And recent radiographic contrast. So the contrast will read as density and show a false reading in your scan. So methods and techniques, there's radiographic absorptiometry, single energy photon, absorptiometry, dual energy photon, single energy, dual energy, quantitative computer tomography, and quantitative ultrasound. So I've done the CT and I've done DXA. So really easy on both. Dual energy, this is the unit here, and the patient lays with their knees up on a block so that the spine is flat up against the table. Both high and low energies ranges are used. A fan beam array. Newer system uses C-arm technology. And this is what the DXA Scout looks like, and you're going to line up the lines between each disc space. So as you can see here, you're going to go through each disc space and have it perfect. You can angle these also so that you're going through the disc space properly. So dual energy, so DXA, two standard used to compare patients' bone density measurements. There's a Z-score and the T-score. The Z-score compares the patient with the average individual of the same age and sex, where the T-score compares the patient with an average young, healthy individual with peak bone mass. So there's Z-scores and T-scores. We look here. We have peak performance, age matched. You have your T-score, your Z-score, and you can see the difference between the two. And you can see red is osteoporosis, this is osteopenia, and this is normal bone mass. So when we look and you can see -1, I don't know why it's a -1, but a -1 is where you go into osteopenia till -2, and then osteoporosis from -2 down. So you can look at the chart and see that this person, this is probably mine. This is what mine has looked like for many, many years. All right. CT, this is what it looks like. So we take one single slice and then we stick a region ROI, a region of interest, right there in the spine, and it calculates the density of the bone. And it gives you a graph based off of that. So there you go. Ultrasound, so it's non-ionizing, which is nice, and they do the calcaneus is the most common. When we're doing a DXA, we usually do T12 to the iliac crest, so we're measuring from L1 through L4, and then we do a true AP of the hip. If we can't do a hip, we'll do a wrist also. So with the spine, you go to mid-sagittal plane, legs flex 60 to 90 degrees to reduce lordosis. The hip, select the hip not previously fractured, so you're going to line it up just like this, so you have the box going through the neck and you're covering the whole hip, and it'll scan it, and you're going to rotate it in 15 to 20 degrees medially, just like you would when you're shooting a hip. So reproducibility is really important, so the ability to obtain consistent BMD values over the same patient over repeated studies. So accuracy is how well measured values reflect true or accurate value of the object measured. So we talked about that earlier. And you want your accuracy of your DXA unit to be better than 10%. So software. So vertebral fracture assessment. So it's software used to diagnose current and potential fractures. So vertebral fracture is the most common in patients over 70. During VFA, a single dual energy scan of the lumbar spine is performed, and software measures the vertebral heights and compares them with reference values. So there's different ways to measure bone density. You'll need to know the different ways and how they work. Okay? There is your bone density lecture.